As we age, our dietary choices become even more critical for maintaining health, vitality, and longevity. For older Americans who often enjoy a variety of vegetables in their daily meals, whether in salads, casseroles, or as sides to classic dishes like meatloaf or grilled chicken, selecting the right vegetables can make a significant difference. However, not all vegetables are created equal. Some can pose risks, especially for seniors managing chronic conditions like heart disease, diabetes, or digestive issues, which are prevalent in the U.S. Conversely, certain vegetables offer exceptional benefits, supporting heart health, cognitive function, and immune strength. In this video, we'll explore 3 vegetables that may not be the best choice for older adults and 3 that are nutritional powerhouses, tailored to the American palate and lifestyle. Let's start with the vegetables to approach with caution. First, raw spinach, while nutrient-rich, can be problematic for seniors. Its high oxalate content may contribute to kidney stones, a concern for the 1 in 10 Americans who develop them, according to the National Kidney Foundation. For those on blood thinners like warfarin, common among elderly Americans, spinach's vitamin K can interfere with medication efficacy. Second, corn, a staple in American diets, think cornbread or corn on the cob, has a high glycemic index, which can spike blood sugar, a risk for the 30% of seniors with diabetes, per the CDC. Lastly, raw cruciferous vegetables like broccoli or cauliflower, often found in salad bars, can cause digestive discomfort, including bloating, which affects seniors with sensitive stomachs or conditions like irritable bowel syndrome (IBS), prevalent in 10 to 15% of older adults. On the flip side, some vegetables are particularly beneficial for seniors. Sweet potatoes, a favorite in Southern cuisine and Thanksgiving spreads, are packed with fiber, beta-carotene, and vitamins that support vision and heart health, critical for the 1 in 4 seniors with cardiovascular issues. Kale, increasingly popular in smoothies and salads across the U.S., is a nutrient-dense leafy green that boosts bone health with calcium and vitamin K, addressing osteoporosis risks in 50% of women and 25% of men over 65, per the NIH. Finally, asparagus, often grilled or roasted as a side dish, is rich in folate and antioxidants, supporting cognitive health, a priority for the 1 in 9 seniors with Alzheimer's or dementia, according to the Alzheimer's Association. Understanding which vegetables to embrace or avoid can empower seniors to make informed choices that align with their health needs and cultural preferences. In the next section, we'll dive deeper into why these vegetables pose risks or benefits, backed by scientific evidence and practical examples, to help you optimize your diet. Vegetables to approach with caution. 1. Raw spinach. Spinach is a beloved leafy green in American diets, often tossed into salads, blended into smoothies, or served as a side. However, for seniors, raw spinach presents several challenges. Its high oxalate content, around 750 milligrams per cup, can bind with calcium in the body, forming crystals that contribute to kidney stones. The National Kidney Foundation notes that kidney stones affect 10% of Americans, with seniors at higher risk due to age-related declines in kidney function. For elderly individuals with a history of stones, consuming raw spinach in large quantities, common in restaurant-sized salads, can exacerbate this risk. Cooking spinach reduces oxalates by up to 50%, making it a safer option, but raw spinach remains a concern. Additionally, spinach is rich in vitamin K, providing about 145 micrograms per cup, which is 120% of the daily recommended intake for seniors. While vitamin K is essential for blood clotting, it can interfere with anticoagulants like warfarin, prescribed to 2.5 million Americans for conditions like atrial fibrillation, common in those over 65. A sudden increase in spinach consumption, such as adding it daily to smoothies, can reduce warfarin's effectiveness, increasing stroke risk. The American Heart Association recommends consistent vitamin K intake, but raw spinach's potency makes it hard to balance. Seniors with digestive sensitivities also face issues. Raw spinach contains fiber and compounds like raffinose, which can cause bloating or gas, particularly for those with IBS or diverticulitis, affecting 10 to 15% of older adults. A 2018 study in the Journal of Gastroenterology found that high-fiber raw vegetables were linked to increased discomfort in IBS patients. For example, a senior eating a large spinach salad at a family barbecue might experience cramping, impacting their quality of life. Evidence and examples. A 2020 case study in Urology Case Reports described a 70-year-old man who developed kidney stones after consuming daily raw spinach smoothies for a month. Similarly, a 2019 American Journal of Medicine report highlighted a 68-year-old woman on warfarin whose INR levels destabilized after increasing raw spinach intake. For seniors accustomed to spinach in American dishes like Cobb salads, moderation, e.g., half a cup serving, or cooking, e.g., sautéed as a side, is key. Alternatives like romaine lettuce offer similar nutrients with fewer risks. Corn is a cornerstone of American cuisine, from corn on the cob at summer cookouts to cornbread at Thanksgiving. However, for seniors, its high glycemic index, GI, of 52 to 70, depending on preparation, poses risks. High GI foods cause rapid blood sugar spikes, a concern for the 29.2% of Americans over 65 with diabetes, per the CDC. A single cup of corn kernels contains 30 grams of carbohydrates, comparable to a slice of white bread, which can elevate blood glucose levels, complicating diabetes management. For seniors on insulin or oral medications, frequent corn consumption, common in dishes like succotash or casseroles, can lead to uncontrolled glucose levels, increasing risks of neuropathy or cardiovascular complications. Corn's low fiber content, about 2 grams per cup, also limits its satiety, potentially leading to overeating, a concern for the 40% of seniors who are obese, according to the NIH. Unlike fiber-rich vegetables, corn doesn't support digestive health effectively, which is critical for seniors with slowed metabolism or constipation, affecting 20% of those over 65. Additionally, corn is often processed into high-fructose corn syrup, found in sodas and snacks popular in the U.S., further exacerbating metabolic issues. Evidence and examples. A 2021 study in diabetes care found that high GI diets, including frequent corn consumption, were associated with a 30% higher risk of glycemic variability in elderly diabetics. A 72-year-old patient in a 2022 Journal of Nutrition case study experienced elevated A1C levels after regularly eating corn-based dishes like polenta. For seniors, limiting corn to occasional servings, e.g., 1/2 cob, and pairing it with low GI foods like grilled zucchini can mitigate risks. Alternatives like quinoa or roasted root vegetables offer similar textures with better glycemic profiles. 3. Raw cruciferous vegetables, broccoli, cauliflower. Cruciferous vegetables like broccoli and cauliflower are staples in American diets, often served raw in crudite platters or salads. While nutritious, they can be hard to digest for seniors due to their high fiber and raffinose content, which ferments in the gut, causing bloating and gas. A 2019 study in Gut found that raw cruciferous vegetables increased abdominal discomfort in 60% of IBS patients, a condition affecting 10 to 15% of seniors. For those with diverticulitis or reduced digestive enzyme production, common with aging, raw broccoli or cauliflower can exacerbate symptoms, leading to pain or irregular bowel movements. Raw cruciferous vegetables also contain goitrogens, compounds that can interfere with thyroid function by inhibiting iodine uptake. The American Thyroid Association notes that 12% of seniors have hypothyroidism, and excessive raw cruciferous intake, e.g., daily salads, may worsen symptoms like fatigue or weight gain. Cooking neutralizes goitrogens, making steamed or roasted versions safer. Additionally, raw forms are harder to chew, posing a choking risk for seniors with dental issues or dysphagia, affecting 15% of those over 70. Evidence and examples. A 2020 Journal of Clinical Gastroenterology study reported that elderly patients with IBS experienced a 40% reduction in bloating when switching from raw to cooked broccoli. A 2018 Thyroid Journal case study described a 75-year-old woman whose hypothyroidism symptoms worsened after daily raw cauliflower salads. For seniors, Roasting broccoli with olive oil or steaming cauliflower for mash offers similar nutrients without digestive or thyroid risks. Alternatives like cooked green beans provide crunch with less strain. Beneficial vegetables. 1. Sweet potatoes. Sweet potatoes are a beloved vegetable in American cuisine, featured in dishes like candied yams or fries. For seniors, they offer exceptional benefits. A medium sweet potato provides 4 grams of fiber, aiding digestion and preventing constipation, a concern for 20% of those over 65. Its beta-carotene, 14,000 IU per cup, supports vision health, critical for the 12% of seniors with age-related macular degeneration, per the American Academy of Ophthalmology. Sweet potatoes also have a moderate GI of 44 to 61, making them a better choice than white potatoes for blood sugar control, benefiting diabetics. Rich in potassium, 542 milligrams per cup, sweet potatoes support heart health by regulating blood pressure, a priority for the 60% of seniors with hypertension, per the CDC. Their antioxidants, like anthocyanins in purple varieties, reduce inflammation, linked to arthritis in 50% of seniors. A 2021 Journal of Nutrition study found that regular sweet potato consumption improved cardiovascular markers in elderly adults. Evidence and examples. A 2022 American Journal of Clinical Nutrition study showed that seniors eating sweet potatoes thrice weekly had a 25% lower risk of constipation. A 70-year-old in a 2020 ophthalmology case study improved retinal health after adding sweet potatoes to meals. Seniors can enjoy baked sweet potatoes as a side or mashed as a base for casseroles, aligning with American comfort food traditions. Pairing with lean protein like turkey enhances benefits. Kale has surged in popularity in the U.S., appearing in salads, chips, and smoothies. For seniors, it's a nutritional powerhouse. A cup of cooked kale provides 1,180 micrograms of vitamin K and 98 milligrams of calcium, supporting bone health, critical for the 50% of women and 25% of men over 65 with osteoporosis, per the NIH. Its antioxidants, like lutein, protect cognitive function, reducing dementia risk, a concern for 11% of seniors, per the Alzheimer's Association. Kale's fiber, 2.6 grams per cup, aids digestion, and its low calorie count, 36 kilocalories, supports weight management. Kale's nitrates improve blood flow, benefiting the 25% of seniors with heart disease. A 2019 circulation study found that leafy green consumption reduced cardiovascular events by 16% in elderly adults. For seniors on warfarin, kale's vitamin K requires consistent intake, but its benefits outweigh risks when moderated. Evidence and examples. A 2021 Journal of Bone and Mineral Research study reported that seniors consuming kale weekly had a 20% lower fracture risk. A 2020 neurology study linked leafy greens to slower cognitive decline in 960 seniors. Seniors can add kale to soups, like a hearty minestrone, or bake it into chips for a familiar snack. Massaging raw kale with lemon reduces toughness, making it easier to chew. 3. Asparagus. Asparagus, often grilled or roasted in American restaurants, is a senior-friendly vegetable. A cup provides 70 micrograms of folate, supporting brain health, crucial for the 1 in 9 seniors with Alzheimer's. Its antioxidants, like glutathione, combat oxidative stress, linked to aging-related diseases. Asparagus's fiber, 3 grams per cup, and diuretic properties promote digestive and urinary health, addressing incontinence, affecting 30% of senior women. Low in calories, 27 kilocalories per cup, and sodium, 2 milligrams, asparagus fits heart-healthy diets, aligning with AHA guidelines for seniors. A 2020 Journal of Alzheimer's Disease study found that folate-rich diets slowed cognitive decline in elderly adults. Evidence and examples. A 2021 American Journal of Clinical Nutrition study showed that asparagus consumption improved urinary health in 65% of seniors with incontinence. A 2019 neurology case study noted cognitive stability in a 73-year-old eating asparagus regularly. Seniors can grill asparagus as a side for steak or blend it into creamy soups, fitting American tastes. Pairing with olive oil enhances nutrient absorption. Seniors can swap risky vegetables for beneficial ones in familiar dishes. Replace raw spinach in salads with cooked kale or romaine. Substitute corn in casseroles with sweet potato cubes. Use roasted broccoli instead of raw in sides. These changes align with American dietary patterns, salads, sides, and comfort foods, while prioritizing health. As we've explored, not all vegetables serve seniors equally. Raw spinach, corn, and raw cruciferous vegetables like broccoli can pose challenges, from kidney stone risks to digestive discomfort, especially for those managing chronic conditions common in older Americans. On the other hand, sweet potatoes, kale, and asparagus offer incredible benefits, supporting your heart, bones, brain, and digestion, while fitting seamlessly into the meals you love, like Thanksgiving yams or grilled sides. By making small swaps, like cooking greens or choosing sweet potatoes over corn, you can nourish your body and enjoy your favorite flavors. Here's to vibrant health and delicious meals in your golden years. Thank you for watching, and don't forget to share this with loved ones who want to eat smarter for a longer, healthier life.